Greetings, everybody. It's time for us to record another installment of Hospital Central Service Technician multiple choice test question review. Please like, share, and subscribe to the channel. It helps me to maintain the channel. The response has been overwhelming, so I'm recording more as many times and as often as I can. Okay, without further delay, let's go with today's assortment of questions. There are a few good ones that I selected for us to go over. So don't forget to transcribe this information on a piece of paper and then into your computer and develop your own study guide. There's a reason why I don't download stuff here. I want to make you work. A little sweat has to be invested in this, so you retain this information forever. Okay, question number one for today. Special attention must be given to house cleaning procedures in the decontamination area. Which of the following guidelines is least appropriate for accomplishing this? Let's try it one more time. Special attention must be given to house cleaning procedures in the decontamination area. Which of the following guidelines is least appropriate for accomplishing this? Our choices for today are, number one, horizontal work surfaces should be cleaned and disinfected in the beginning and end of each shift. Floors should be cleaned and disinfected weekly. Next, spills should be spot cleaned immediately, and biohazardous waste should be removed at frequent intervals. Let's try our answers again. Horizontal work surfaces should be cleaned and disinfected in the beginning and end of each shift. Floors should be cleaned and disinfected weekly. Spills should be spot cleaned immediately, and biohazardous waste should be removed at frequent intervals. Okay, now let's remind ourselves that this question is about least appropriate in decontamination area. So the question was, as a reminder, special attention must be given to house cleaning procedures in the decontamination area. Which of the following guidelines is least appropriate for accomplishing this? Decontamination area, wet. It's the dirtiest place in the entire hospital. Okay? Sickest place, as a matter of fact. So logic would dictate that, it should be done often. Now, which parts talk about things being done often? Answer number one was horizontal work surface should be cleaned and disinfected at the beginning and end of each shift. Well, yes, even in decon, where we don't have too many horizontal surfaces, this is mostly for assembly or prep and pack area. But nonetheless, when you come on the shift, you clean your area. When you end your shift, you clean your area. So this seems rather correct. But we're talking about decontamination area. Now, the next selection is, remember, we're talking about least appropriate. Next selection says floors should be cleaned and disinfected weekly. Come again? I don't think so. So floor should be cleaned and disinfected weekly. No, floors are cleaned and disinfected as needed and at least daily, which means every shift. So I'm already suspicious of this answer here. As a matter of fact, I'm willing to go on a limb here and say, this is probably the correct answer, but let's look at the other ones. Spills should be spot cleaned immediately. Well, that is correct. As soon as something spills, you clean it up right away. You don't leave it for someone to, slip and fall on it at the very least, or to cross-contaminate something. So that's correct. Biohazardous waste should be removed at frequent intervals. Yes, absolutely correct. So our answer here, floors should be cleaned and disinfected weekly in the decontamination area, is wrong. And remember, the question said, which of the following guidelines is least appropriate? Well, this is least appropriate. Okay, hopefully that made sense. Let's go to the next question that I selected for you. And that leads us to the land of the medwatch program. So the medwatch program is used for which of the following reasons? Is it number one, for approval of new medical devices? Number two, for reporting adverse events associated with drugs and medical devices? Three, for reporting high-risk procedures? And four, for checking adequate labeling of devices. So what is the MedWatch program? Who administers the MedWatch program? Well, it's our old friend, the FDA, or the Food and Drug Administration. And its sole purpose is to report for general public and healthcare professionals to report anything having to do with any adverse reactions for either drugs or medical devices. Okay, so in this particular case, it's a no-brainer, where we say that the correct answer is number 2 for reporting adverse events associated with drugs and medical devices. I want to give you those answers once again. So the question was, the MedWatch program is used for which of the following reasons? 1, for approval of new medical devices. That's not true. 2, for reporting adverse events associated with drugs and medical devices. Correct. That's our answer. Number 3, for reporting high-risk procedures. No. And 4, for checking adequate labeling of devices. That's not the case. So off we go. All right. Next question. Which of the following is an example of surgical asepsis? Number 1, hand washing. Number 2, decontamination of equipment. Number 3, sterilization of instruments. And 4, gloving. Now, let's talk about this. The question was, which of the following is an example of surgical asepsis? When you think surgery, you always think sterile. Now, the trouble that we get into a lot of the times is when we confuse surgical asepsis with medical asepsis. Okay, they're different. They're different things. Okay, so medical asepsis, for example, simply reduces the number of organisms present. Period. Okay, so it would be comparable to the word disinfection. Disinfection is the destruction of most microorganisms, while sterilization is the destruction of all microorganisms. So when we talk about surgical asepsis, when you hear the word surgical, the word sterile must be the first on the list here. So when we talk about, which of the following is an example of surgical asepsis, is it hand washing? No. Decontamination of equipment, decontamination is synonymous with disinfection, so no. Sterilization, ding, 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 ding. And gloving, well, guess what? Our answer here is the choice number 3, sterilization of instruments. That would be the surgical asepsis. Remember, don't confuse the two, surgical and medical asepsis. Let's see, what else do I have for us today? This is a good one. I love that one. Okay, ready? Let's go. And okay, here we go. The average concentration of a chemical in the air to which a worker can be legally exposed over a particular period of time is the what? Let's read the question one more time. The average concentration of a chemical in the air to which a worker can be legally exposed over a particular period of time is the what? Number 1, is it the STEL, which is a short-term exposure limit? Is it AL, action level? Is it 3, TWA, time weighted average? Is it number 4, permissible exposure limit? Let's look at the question one more time. The average concentration of a chemical in the air to which a worker can be legally exposed over a particular amount of time. I want to show you that there are 2 answers here which have the word exposure or exposed here. They're either short-term exposure limit, STEL, and the PEL, which is permissible exposure limit. Okay, this is a very confusing question, as they want to sort of throw in words like over a particular period of time, and so on and so forth, but in reality, when you look at these questions, you have to look for similarities in language. And there are 2 items here which have similarities, and that would be 2 possible answers: short-term exposure limit, STEL, and permissible exposure limit. Now, the question says, concentration of a chemical in the air to which a worker can be legally exposed, which legally means something is permitted. So if you use logic, the answer here is permissible exposure limit, which is the PEL. Now, we can talk for a while about what an action level is and what an STEL is and what time weighted average actually is. Time-weighted average is when you weigh the exposure over an 8-hour shift. Okay, that's what we usually talk about. So that's the stuff that you need to look for when looking at time-weighted average. But I do want you to sort of use logic here, and you will be able to arrive at a correct answer. Okay, let's go to the next question. A solution which inhibits the growth of bacteria on skin is called what? A solution which inhibits the growth of bacteria on skin is called what? Now, last time I reviewed a batch of questions, we actually addressed some of the differences in language, but let's look at the what we have here as our choices. A solution which inhibits the growth of bacteria on skin is called what? Is it a disinfectant? Is it an antiseptic? Is it bactericidal? Or is it a sanitizer? Interesting. Interesting. Okay, so last time I think we addressed this when we talked about two different words, and these are two first options, disinfectant and an antiseptic. Disinfectant is used on inanimate objects, on things. And then the next answer is antiseptic, which is living things or living creatures. So this is something you need to sort of keep in mind here, that the word disinfectant is already gone. It doesn't exist in this question because we're talking about growth of bacteria on the skin. So antiseptic would be a potential fit. The next answer is bactericidal. Now, bactericidal is a generic term, which means to kill bacteria. Bacteria and cidal. Cide, C-I-D-E, on the end is always means to kill. Suicide, homicide, homicidal, suicidal. You know, when you have a C-I-D-E or C-I-D-A-L on the end, that means to kill. So bactericidal, what could be a good answer, is not the answer they're looking for because they're looking for specifically on the skin. So in this particular, if you were to go, toe to toe, whether it's antiseptic or bactericidal, you choose antiseptic because antiseptic is for skin, for living things. That's the cream you put on if you cut yourself. Okay. And the last choice was sanitizer. Folks, we don't use the word sanitize in sterile processing. So that would be completely and totally, disqualified. You may confuse, because you've heard, the word sanitize or sanitizers used indiscriminately, but it's not true. It's not true. Sanitization has nothing to do with sterile processing. Never consider this term. It's good for a kitchen, not decontamination area, just kitchen. So the correct answer here is antiseptic. That would be the correct answer. Let's see. Let's do one or two more. Let's see what happens. Okay. I hope this answer made sense. Let's go to the next one. In terms of marking instruments, which of the following statements is least accurate? Folks, be very careful with these words here. Like in this particular case, is least accurate. Okay, because they're going to throw in some answers which are most accurate. It's, oh, I know that one. That must be true. No, concentrate on the language. Language is key to your success. In terms of marking instruments, which of the following statements is least accurate? Okay, marking instruments. Sometimes we call it instrument identification. There are several ways we identify instruments. Okay, it could be acid base etching, it could be laser, it could be nylon shrink wrap, it could be tape, it could be engraving. Okay, but in our department, there are certain favorite things that we do and certainly the least favorite. Now let's look at our answers. First, let's do the question again. In terms of marking instruments, which of the following statements is least accurate? Number one, engraving is preferred in order to eliminate corrosion. 2, tape must overlap but not be multi-layered and be smooth. 3, tape should not be placed on areas of the instrument that will be handled. 4, some manufacturers mark instruments by using coating process on parts of the instrument. Okay, so we love tape. in the departments, that's the easiest, safest, and the best way for us to mark instruments. We don't have access to lasers. We don't have access to acids or bases to mark our instruments. We usually rely on manufacturers or our suppliers to do that for us. So we use tape. But engraving, oh, my friends, we don't engrave instruments. Remember, surgical steel is during the manufacture process is passing. It goes through a process called passivation. If you start engraving or scratching your instruments, you are removing that special protective coating and you are destroying the finish of the instrument. So that's going to lead to corrosion. So the correct answer here is engraving is preferred in order to eliminate corrosion is on its face patently wrong. So with that, this is our correct answer. Okay, we can talk about this for a while, but in reality, this is what it is. Okay, next question. Storage room temperature should be what? By storage, I assume they mean sterile storage. I mean, that's the only storage that we have. So sterile storage. So immediately go back in your mind, revisit the ideas. Hey, what's the humidity level? What's the temperature range in sterile storage? How many, what is the air pressure, what is the air circulation rate, and you remind yourself of all of these things. We talk about 4 complete air exchanges per hour, but that's not temperature. We're just reminding ourselves here. We're talking about humidity levels, that you need to recall, and of course the temperature. The temperature in Fahrenheit should be 75 degrees or less in sterile storage. The options that we have here, 98.6 is the body temperature, 90 degrees Fahrenheit, a bit too high, 85% high, 75, ding, 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 ding. That's the correct answer. This is what we have here. Okay, let's do 1 or 2 more. Let's see what I have here for you. All right, next question. Each of the following statements about the objectives of the packaging process is accurate except big, big, big except. Each of the following statements about the objectives of the packaging process is accurate except. Let's quickly remind ourselves what packaging is used for. Packaging is used for protection. Packaging is used to display the signs of the sterilization process, right? Packaging is used sometimes to identify what's inside. But more importantly, packaging is used to facilitate the process of sterilization. And what is that process? Let the sterilant go in, interact with surgical instruments inside, and let all of the sterilant come out of the package. That is the whole purpose of sterile packaging, period. So let's look at the answers here. The packaging materials must be able to maintain the sterility of the package contents until it is open. Sounds good. Number 2, the contents of a sterilized package must be sterile at the moment of use. That sounds about right. 3, the packaging must allow penetration of sterilant. I misread the answer. The packaging must not allow penetration of sterilant. Oh, hello. So the question was all of, which one are accurate except. What did I just say when I went over, we're talking about packaging, what is it good for? It's, to facilitate the process of sterilization, let the sterilant in, let the sterilant out. I haven't even read answer number 4 yet, but I know darn well that the sterilant must penetrate the packaging. So I'm almost certain that this is the correct answer. Let's look at the last one. The packaging process must create a package that can be opened aseptically by the user. Yes, that is true, because packaging material must also provide for sterile presentation. Yes, I'm sorry, I failed to mention that. So the correct answer here is the packaging must not allow penetration of sterilant on its face. It's patently false. That's the correct answer here for us. So there we go. One more. Let's do one more last one. Okay. Ready? The Joint Commission requires facilities to select at least one high-risk process for proactive risk assessment each year. It also requires facilities to conduct root cause analysis on any Sentinel event that has occurred. A Sentinel event is best described as which of the following. So I want to tell you that most of this question you can just dismiss. The only thing worth reading in this question is this. A sentinel event is best described as which of the following? Now, again, language is everything, and I want to ask you, hey, what is a sentinel? Or rather, who is a sentinel? Think about the term sentinel. Sentinel is a guard, a person who stands guard. Imagine a castle. Inside there's a king and the queen, and outside is a sentinel who is looking to make sure that no one who wants to do harm to the king and the queen gets by. In our case, the king and the queen is the patient. Okay? And a sentinel event, when we do something so wrong that the patient dies or gets injured terribly. Now, that is a sentinel event. Okay, now let's look. So let's dismiss the entire. Let me read it to you once again. The Joint Commission requires. So automatically you think, oh, geez, Joint Commission. Again, throw everything out. The Joint Commission requires facilities to select at least one high-risk process for a proactive risk assessment each year. It also requires facilities to conduct root cause analysis on any sentinel event that has occurred. A sentinel event is best described as which of the following? Remember, this is the only part of the question that matters. A sentinel event is best described as which of the following? But they want to confuse you. Your job is to be unconfused. Answer number one, an unexpected occurrence involving death, serious injury, or risk thereof. Oh gosh. My explanation already gave away the very first choice here is correct answer. Okay, but let's look at the other choices. The development of a new process or technique for sterilization, no. A process control measure, no. An event related, also no, because a sentinel event leads to death or serious injury to the patient. And we're done with today's recording. I want to wish you all success and blessings in your pursuit of excellence in sterile processing. Once again, please like, share, and subscribe to the channel. It helps me run it, and your feedback is most essential to me. Thank you very much. Have a wonderful day. All the best to you all.